All right, so you've got an old scar that you don't like, and you're interested in options to improve it, right? I'm Dr. Cohen with the Cohen Clinic, and I see patients all the time who come to see me for scars of various reasons. The most common one is one from a previous facelift. So often more traditional facelifts will create some very obvious scarring around the ears, and patients don't like that. It's a telltale sign that something was done. So the best way to improve the appearance of that scar, truthfully, is to simply cut it out. But I can't do that unless I'm able to cut it out with no tension. So that's the key. If your face has matured to the point where you now have enough movement in your face where we can do a revision lift and generate enough laxity to where I can remove your old scar, that's best case scenario. If you don't, and moving things around would create too much tension or kind of a windswept pulled appearance, which we don't want to do, then you have to go to other options. So keeping the scar there, but just making it look more invisible. You have options like microneedling, where you can do multiple sessions of microneedling to get the scar to remodel, or we can do lasers to do a similar idea, or we can inject it with a steroid or an anti-inflammatory to get the scar to settle down, especially if it's raised or hypertrophic. So I hope these are some helpful options. If you're interested in learning more, or if you have a scar that you are concerned about, then I recommend just send my coordinators some pictures and we'll see if we have options for you. So thanks for watching.